uncontrolled diabetes. So what are all the steps that you could help us to optimize their blood glucose levels? I think it was well said though, because I hear a lot about leaky gut, and many of my subscribers have also asked about the leaky gut as well, because how the inflammation, you have explained it very well, how when somebody is diagnosed newly with diabetes, the most of the things, rather than the medications, we always think about what are all the diet, lifestyle changes, and how can we look into the root cause of the problem so that we can optimize the blood glucose. About what's the relationship between diabetes and gut health, and why it is so important to understand our gut health in order to optimize the diabetes. Hi everyone, this is Dr. Sankari Kasi, and I am a family medicine physician based here in California. Welcome to my YouTube channel. Today I'm going to discuss about a very important topic, which is diabetes. We hear a lot about someone who is diagnosed with diabetes or pre-diabetes, or someone who has complications with diabetes such as retinopathy, or they may have chronic liver diseases or fatty liver, or they can also have high blood pressure along with diabetes, or diabetes nephropathy, neuropathy, or cardiovascular disease related to diabetes. So there are so many things that happens because of complications of diabetes, just because your blood glucose is not very well controlled. So in this video, we are going to discuss about how we can manage our health as overall, finding out the root cause of the problem, like why you have diabetes, why there is chronic inflammation, and what are all the food changes that you can make, and what are all the diet changes you can make in order to optimize or control your blood glucose levels. If you have not subscribed to my channel, make sure to subscribe to my channel, and I have a special guest, and let's get into the video. Hello everyone, welcome to my YouTube channel. Today I have a special guest in our podcast channel. Hi, Dr. Rekha Murali.
Hi.
Nice to see you in my channel.
Thank you so much for inviting me.
So Dr. Rekha Murali, she is a functional medicine specialist. She is an internal medicine specialist, and she has been practicing internal medicine for more than 3 decades. And she also found out like how she can better improve her health of the other patients. So she is also doing homeopathy, and she also certified, she practices functional medicine so that it will be able to optimize a lot of patients in their chronic diseases. And I'm so happy to have her here, because her main as well as the best mode of practice is not just taking care of the illnesses. On top of taking care of the illnesses, she also addresses the root cause of the many of the medical problems. I'm so happy to have her here, and let's get into the video.
Thank you so much for the introduction.
Hi, Dr. Rekha. So today we'll talk about the diabetes, which is so much common in many of the patients that we see everyday practice. And nowadays I do see a lot of adults, especially in US and also in India. I hear from my friends like how they have been diagnosed with diabetes recently. So when somebody is diagnosed newly with diabetes, the most of the things, rather than the medications, we always think about what are all the diet, lifestyle changes, and how can we look into the root cause of the problem so that we can optimize the blood glucose.
Yeah, so a lot of thoughts enter my mind, because I've been doing this for a long time. So I just want to make sure that patients understand that high blood sugars are not just the only problem, right? Because people are focusing on the diet, trying to get low carb diets in, and most of the diets don't work, right? So we have to personalize the diet, which means we need to look in deeper to see what would be the proper diet that should be customized for a patient. So when I take someone in, I'm looking at a couple of factors. One is how long have they had diabetes, or how long have they had pre-diabetes? Because usually diabetes didn't occur today, it occurs 10 or 15 years ago, and it started with pre-diabetes, and pre-diabetes oftentimes is like there for 10 or 15 years before someone becomes diabetic. Then I'm looking at medications. How many pills have they tried? What have they failed? How many doses are they on? And then I'm looking at what is happening with their genetics, because family history plays a major role. Then I'm looking at their lifestyle, right? What's happening with their sleep, their stress, their diet? Are they exercising? Are they stress eating? And then I'm looking at the next factor, which will be look at what complications do they have? Do they have neuropathy, kidney problems? Do they have heart disease? Do they have eye problems? So there's a lot of in-depth discussion on all this. Then I would review their lab records. I will review their medical records. Then we will go into a discussion on interview of the family's other patients' history. So the medical history is very elaborate in functional medicine. We want to go from when they were born. What all triggers or insults or trauma have they faced? Because a lot of time that will surface out in a chronic disease process. So when a patient comes, there's all these different aspects that we have to address. And then once we do that, then we will chart out a proper, steps, what to do next.
So the first we talked about how the medical history is very important for a patient, even though they come with one problem, but then you just look into all the other factors that is counted in.
Yeah. And oftentimes they are on medications, not just for diabetes. They may be on something for high cholesterol. They may have autoimmune disorders. They may have heart disease, and they may be on multiple medications for that. So it's a combination of everything. I have to look at the overall picture to understand more about their root cause approach and what could be the good approach for them, right? Because in the end, it's not about just trying to fix something, right? We want to really look into their microenvironment, and we want to get that process going and optimizing it to the best that we can. So then the next step would be, after we set up a patient and we interview them, the next step would be thinking about what kind of an advanced lab test would be useful at this time. And oftentimes it will be gut health, because as you know, gut health is very important. And my next aspect of this discussion will be about diabetes and gut health.
Okay. So Dr. Rekha, I wanted to ask you about what's the relationship between diabetes and gut health, and why it is so important to understand our gut health in order to optimize the diabetes.
Okay, so to explain it very simply, gut health is the source of a lot of functions. So if something goes wrong with gut health, it ends up in a disease process. So let's start with, what is the gut really useful for? So the gut, first of all, is the first line of defense, is the gut lining. So if somebody is eating food, we have a gut mucosa that actually separates out harmful bacteria or harmful toxins, anything that's coming in the body, and allows only the nutrients, like the food particles, to come where the gut bacteria are living on the mucosa. So they are helping break down the gut, the foods that we eat, into smaller particles so we can absorb them.
Okay.
So interestingly, we have only one layer of gut cells. So between the mucosa, the gut cells, and then there's blood. So as you can think about, this is a very small
layer
area, and very easily can get damaged.
Okay.
So if someone having, for example, foods that are the wrong choices, they're eating the wrong foods, maybe high carb diet. So what that's going to do is it's going to feed the bacteria, and you'll have overgrowth of the wrong population.
Oh, the bad bacteria grows in. Okay.
So generally we do not say bad bacteria because we want a balance in the bacteria. All the bacteria that are residing there are important to digestion.
Okay.
But they only live well when they're in harmony. So like in the forest, if you have, one kind of species that takes over, the forest gets destroyed. Same thing here. So you want to have a balanced environment, so that all the functioning of the body's functioning is done by the gut bacteria.
Okay.
So that is one part, is the nutrients, right? Being absorbed. Digestion takes part in the gut. The immune system is based in the gut. So 70% of our immune system is in the gut lining.
Okay.
So if somebody has, for example, a lot of stress. So one aspect is stress. So stress and sleep are very under, recognized in the medical community, and I want to bring that to attention, because someone who has a lot of stress ends up having higher cortisol. Some amount of stress is needed, right? It's like we have acute stress, it can be helpful. For example, someone who's preparing for the Olympics, many records are broken during Olympics because their cortisol goes so high. But if you have chronic stress, it's actually very damaging. So it can actually cause a problem with the mucosa. It can cause compromisation. That means if your mucosa is compromised, now you're letting a lot of other things come in, other biochemicals coming in, bacteria coming in, toxins coming in, so a lot of other stuff that shouldn't be there coming in, right? So now this can be a problem, because then it can cause what is called increased gut permeability. And this increases the white blood cells that are in the blood, that are policing the cells, Now when they get stimulated, because they're seeing a lot of unidentified particles coming in, and it could be food particles that are not digested into nanoparticles like they should. Now you're having larger particles seeping in because of the leaky gut. Then your immune system is going to mount a response, and that gives rise to a lot of inflammation. So this chronic inflammation can occur over years. So they can be damaged starting out in a small area, and slowly it can keep increasing, and the inflammatory molecules that are going around can go to the joints, cause joint aches and pains, can go to the thyroid, cause hypothyroidism. They can go across the the brain, blood-brain barrier, and cause other problems in the brain like brain fog. They can affect your memory. So this is just a small aspect of what I'm telling you, that the gut, a leaky gut can cause or increase gut permeability in medical terms.
Okay. I think it was well said though, because I hear a lot about leaky gut, and many of my subscribers have also asked about the leaky gut as well, because how the inflammation, you have explained it very well, how the inflammatory cells can cause the disturbance and the inflammation. It also raises the inflammation and how it is attached to other autoimmune conditions and other things as well. So let's coming on to the diabetes. So we talked about the stress, we talked about the sleep, we talked about the gut bacteria. So how, as a patient, if they come to you, for example, if someone has a uncontrolled diabetes, so what are all the steps that you could help us to optimize their blood glucose levels?
So I would now start looking at what's happening with their gut health, right? So I will look at, do they have insulin resistance? What are they having? So I would look at their symptoms. Sometimes I can tell insulin resistance just by symptoms alone, and oftentimes it'll be fatigue. It's chronic fatigue. People having these known crashes even after eating, the blood sugars crash. Then they might be having high blood pressure. If you look at metabolic syndrome, they have increased abdominal girth. The waist to hip ratio increases. And so they can have all these sleep disturbances, everything that comes with metabolic syndrome in addition. So now we're looking at how can we address these factors by looking at the gut health. So now we're going to do specific testing for the gut health, and then once we have some kind of a response from the test as a results, we can now look at what can we actually do based on the results. At the same time, we're also reviewing their lifestyle. We're looking at what's happening with their sleep, their diet, the exercise. All these are parts that they have to focus on. So this is where the health coaching part is very, very useful. Because for someone to change their mindset around food, which they've always had a wrong thoughts about foods, or they have these urges, they have sugar cravings, to get them out of it, it takes a couple of weeks. And it needs someone to be having accountability, so then they will focus on actually getting these steps done. This was a challenge when I was a physician only first. Now I'm a health coach too. I would tell patients to do all these steps, and they would do a bit of it, maybe none of it, and they found it was very overwhelming. So now I realized that as a health coach, we actually offer options. If I have 3 steps I want them to take, I will tell them, look at these 3 steps. Which one do you think you can achieve? So once you give them the choice and they own it, they are more likely to do those steps. So that's what I do in our practice. And once they start seeing results, because once we are personalizing their approach, their diet is going to change because of the lab test. We're going to maybe add supplements if they need, if they're low on nutrients. We will give them certain nutrients to improve insulin sensitivity. It could include chromium, vanadium. We can give sometimes a selenium. And then of course there are other like berberine that can actually also help with insulin sensitivity as well. And also helps with weight loss. But everything should be taken in the context of all the medications they're on, interactions that can occur. So it should always be done under supervision.
With the healthcare provider.
Always with the healthcare provider. So that would be the thing. And because of the coaching, we see them weekly once.
So you see them weekly. So if someone makes those changes, especially gut bacteria, stress, exercises, and improvise their sleep as well, you said within 2 weeks they can make those changes?
They are actually so shocked. Most of the patients, when they come into our program, they're like, I've been like this for years. I cannot. First, they are in disbelief that this can even happen. But once they join the program and they actually start seeing the difference, and the best part about our group program is everyone can compare notes to see, when we started out, what were they like. And of course, for confidentiality, I will tell them, you don't have to say what medications you're on or what your weight is like, but you can say, did I lose 5 pounds? Did I lose 3 pounds? Or have I gone down on the dosing of medications, which of course doesn't happen in 2 weeks. It'll happen during the time of the program. But by the end of the program, so it's an 8-week program. Right now, I'm very happy. We had one patient off 32 units of insulin in just 8 weeks. And now we are taking him off, lowering the dose of some of his other medications. So it's a process. So 8 weeks is just a little time for them to get adjusted to a new mindset, to understand that yes, there are changes that they can do that will be productive for them, and there is a possibility that they can get on lower doses or off medications. And this is what I wanted to tell, because many patients are in that mindset that once I have diabetes, I'm always going to be
Be the
diabetic.
for the rest of my
But
life.
it's not true. There are ways around it.
Okay. And then I wanted to ask you about how can we improve your gut health? Like, for example, you mentioned about high carbohydrate diet. We have the processed food, processed meat, and then there are so many of the things like sodas and caffeine. So how can we improve our gut health?
Yeah, so anything that has comes in a package, I always tell patients, they have additives, they always have something. So try to eat wholesome foods that come straight from the farm to your table, preferably not something that's sitting up in your refrigerator for weeks, because even the stuff we get from the grocery store, right, they don't come right away. They take 1 or 2 weeks to reach there. Then by the time it comes to your home, by the time you cook it, you're losing a lot of nutrients.
Okay.
So I always tell patients, cook, less, and then buy twice a week. Don't buy for a whole week, and then a lot of times everything gets, spoiled or rotten, or, they're losing their antioxidant levels, right? And then of course the diet can change during our treatments. So I always tell them everything depends on how you prep your meals.
Oh, prep the meal is also important.
Yes, very important, because it's not about just saying I'll do this and this and this change, right? What am I going to do next to maintain a certain diet at least for 1 week? What are the things you need to buy? So we give them all the resources. We give them, what are the timing of the cooking, what are the meal preps you need to do, and what are the meals look like. We'll talk about plating.
And the plating, yes.
Yeah, plating method, and looking at, what should be the focus on your meals, and also how to pair certain carbohydrates and with fats or proteins to reduce the sugar surge. That's very important. I also teach them how to look at the CGM, the continuous glucose monitor, which is, I think, the best thing they really needed. It really motivates them, because when they start with their baseline, their sugars are all over the place, and then once they start doing our program, they start seeing the highs are starting to come down, and then when they're also off medications, they can actually see that it's maintaining. So with the help of the CGM, they can also optimize that. So you're saying it's like the plating and also the correct and the mixed amount of complex carbohydrates, as well as the protein, as well as the fiber in the plating, and also meal prep. That helps a lot, which I also share with a lot of my patients, like prepping the meal, which also helps them a lot. And coming on to the exercises and how much, and then everybody is busy in their lifestyle, but then how much of exercises would you recommend in order to maintain the blood glucose? This is a really good question, because I always have patients coming and saying, do I have to do so much exercise? I'm like, no, we start at where you are. So if you are doing, for example, step count is an easy way to assess, what your activity level is. Of course, that's not the only way, but it's one of the ways. So it's an easy one for older patients. So I'll always tell them, look at your step count, because everyone has a phone or a watch. And then you look at your bases, your basics. So if you're doing, say, for example, 4,000 steps per day for a week, then we're going to add 1,000 steps more
so it's slowly increase it.
Yeah, slowly increase it. And then I tell them, whenever you go shopping, right, eat something light before you go. Otherwise, you're going to buy some bad foods that will not be good for you. So these are tips I give them.
So don't go hungry when you're shopping.
Exactly. This is, it can sabotage my diet too. It's happened. So I know from personal experience that having something in is always better. And then when you go, I tell them park as far away as possible.
So you can walk longer.
Leave the
shopping.
Closer slots for someone else who needs it. But you park the furthest. That's an extra walk without even you realizing. And then when they go into the grocery store, I say do 3 runs first. Walk around, don't buy right away. So that gives you some time to look around and see what is good. And then you start your shopping. And same thing after meals. This is very important, by the way. Every meal that someone has, we are going to expect the uptake in sugar. Just 10 or 15 minutes of walking after a meal is amazing to lower the blood sugars. Second thing is, what food should you eat first? So I always tell patients, eat vegetables first, then proteins and healthy fats.
So vegetables first, protein,
and then your carbs, like something else like rice or later. Because the vegetables have so much fiber, they don't allow the release of the sugars to go up that high. And if you pair it with a protein or a healthy fat, again, the sugars can't get up as much. Right? So it keeps it more at a baseline. So these are some of the tips for our patients.
These are very helpful tips. Like, for example, how can you do shopping and what kind of exercises that you do, because somebody who is a beginner who has not been doing much of exercises is slowly increasing from, as you mentioned, like 4,000 steps to 5,000 or 6,000 steps. So somebody who walks after every meal, they can definitely optimize their blood glucose, their insulin resistance also improve, their insulin sensitivity goes up. So these are all great tips. Like someone especially who is a diabetic, watch out your stress level, your sleep, and what are the foods that you can eat, and what are all the exercises that you can do, and you can definitely optimize your blood glucose levels. And Dr. Rekha, the next question I have is about the complications. I'm sure you will see a lot of complications, especially starting from retinopathy, nephropathy, neuropathy, and also fatty liver disease is more common. So those are a lot of the complications from diabetes that we see in everyday practice. So how do you address those complications?
Yeah, so it's very simple. When you bring the inflammation down, a lot of those complications improve. So we get patients with heart disease, for example. Now, of course, we have patients with stents and have, patients who have, CT angio that's done that shows blockage. So a lot of times I tell them that is a long-term complication that can be improved upon. We cannot obviously reverse a lot of things, but we can improve retinopathy. For example, I had a patient with retinopathy where she was having poor vision and she was supposed to get some injections for her eyes. And she came to our program to see, not for that, she came for her diabetes. And she asked me incidentally, can you help me with the eyes? So I told her, first let's work on your sugars and let's see what happens. So when we had her join our program, under 3 months, her eye cleared up and she went back to her eye doctor and he said all the edema is gone. So it is possible to improve some of the complications by reducing inflammation. So you can understand how this chronic inflammation has such a big role to play in complications. So understanding that gives them more motivation once they know that, okay, their retinopathy got better. So then they're focusing more on reducing that inflammation and continuing with the diet.
Okay.
So that for me is a win.
Okay. So reducing the inflammation is mostly by the gut microbiome, right? Like how you explained to us is improving the gut microbiome can reduce their inflammation, and that can also help them with optimizing the other the diabetes as well as the complications.
Yeah. So there are other ways to also measure how the inflammation is going down. Usually they will have weight loss. So weight loss resistance can happen when they're inflamed. A lot of people try everything and they still cannot lose weight. So once we start their specific diet that's tailored for them, then we start noticing weight loss. People have better sleep, and then the fatty liver starts resolving. They start getting better numbers. And then, of course, medication go down, dosing goes down. So that's good because there are a lot of side effects from medications itself. And then we're also looking at their micronutrient levels. Because a lot of time when they're in chronic inflammation, it's an active process. So the problem with chronic inflammation, it also uses up your nutrients. And you may be thinking you're eating a healthy diet, which might be inflammatory for you. And then if you're low on nutrients, that's not going to help you, right? So we want to also check their nutrient levels. And then we focus on overall making sure the inflammation is down. And the best result is when someone starts saying, I'm already feeling better. Their sugars are better. That's a sign that the inflammation is coming down.
Okay. And I also wanted to ask a question about the protein. Like a lot of patients, they say, oh, if I eat all protein meal in my diet, my everything can be reversed. Is that true? Or how much of protein and what are the different good proteins that you can take?
Yeah, so proteins are by itself a big discussion. But I do tell patients not to get carried away by just focusing only on proteins, because you need the fiber, you need the vegetables, right? You need whole, maybe whole grains. So you need to have a balanced diet. And so I do also recommend not going too high in proteins because it might stress your kidney out, especially when someone's diabetic, they already have stressed out kidneys. So this might just complicate things. So we always start with a diet that's average, but focused on what is specific for them. That's anti-inflammatory for them. Then we start increasing the proteins, good quality proteins, and then high quality fats. So healthy fats can be from salmon, all the omega-3s. You can get from chia seeds, you can get from flaxseed powder. By the way, flax seeds are not as good as flaxseed powder itself.
Powder is well absorbed. Yes.
And then chia seeds, always soak them overnight so you can get the most out of it. And then there are all these nuts they can have. But again, everything should be in moderation and should be supervised with someone who can actually look at your plating, make sure you're getting adequate calories from the macronutrients that you need. Macronutrients being the fats, the proteins, and the carbohydrates. And the micronutrients are what is all the minerals, and those a lot of times will be supplemented.
Okay.
And supplements are, again, only supplements. The diet is the main thing. And I tell patients, don't rely on supplements for long, because we just want to give it time until your gut health is optimized. And at that point, you can absorb more nutrients, and then we can back away from the supplements. Yeah, so they're temporary.
Okay, good. Thank you so much for taking the time. I know you had a busy schedule in between your patients, and you took some time for us to do this podcast with you, because for years I've always been wondering, like, what is this functional medicine and what is this gut health and what is the relationship between the diabetes and inflammation, insulin resistance. So you've answered many of the questions regarding how a person can eat healthy and they can stay healthy and optimize their blood glucose levels. Thank you so much for taking the time, and I will see you in my next podcast.
Okay, thank you so much for having me. I enjoyed discussing and giving out some tips.
Thank you.